My name is David Sable, Summer 2 course for Medical Terminology, HESC 105 DE01H. My presentation will be on Creutzfeldt-Jakob disease in the three major forms. I will not get into variant CJD, which is mad cow disease. So, during the 1920s, two Austrian physicians by the name of Dr. Hans Creutzfeldt and Dr. Alfonso Jakob had noticed similar symptoms in their patients. And after writing papers on their patients, they kind of got credited for discovering CJD. That's why it's called Creutzfeldt-Jakob. So what is CJD? CJD is believed to occur when a proteinaceous prion particle attacks the brain and puts holes in the tissues of the brain. It's a very rare degenerative brain disorder. Kind of old terminology is a TSC, or a transmissible spongiform encephalopathy. This is basically any disease process of the brain in which perforations occur in the tissue of the brain. Now its common terminology is called prions disease, and that's any human or animal related brain disorder in which, again, holes form in the brain. So there are three major types of Creutzfeldt-Jakob disease. It's sporadic, familial, and iatrogenic. Sporadic occurs in about 85% of new cases a year. It's definitely the most common form of CJD. They're not sure what's causing the proteins in the brain to mutate. However, recent research is finding that there is some sort of virus behind the mutation, but it's still in its early stages. They're not really sure what's causing the proteins to mutate. The second form is familial, which occurs in about 10 to 15% of new cases a year. Now, familial CJD is inherited autosomally. So what this means is that it only takes one bad protein from the parent to give the child a 50% chance of contracting CJD. Now, there is a simple blood test you can take that can detect familial CJD. So that's important to help with the prevention of the spread of disease. The last form is called iatrogenic. Now, iatrogenic is anything originating from a physician. It's the least common form, only occurring in about 1% of new cases a year. And what they realized is that individuals who had just undergone specific types of surgeries or procedures, like a corneal transplant, had dura mater taken, growth hormones from the pituitary gland, or was exposed to any type of poorly sanitized stereotactic electroencephalography electrodes. What they had noticed that whether or not it was taken from a living or dead patient with CJD, it was transmitting to the living patient. When it comes to diagnosing CJD, the first option is to rule out other forms of dementia. It used to be the only way to get a 100% reading of CJD was to either do a brain biopsy or an autopsy. However, brain biopsies were usually discouraged because even if they detected CJD, the patient was usually around the age of 60, and because there is no cure for CJD, it kind of makes the brain biopsy a little pointless, so they don't typically encourage getting a brain biopsy done. Now, one of the new things, German scientists have discovered that by getting cerebrospinal fluid from the patient and looking for the protein 14-3-3, they could actually highlight the protein particles using a laser beam to help detect it. Again, it's in its early stages, so they're not too sure whether or not it's a 100% chance, but it does help detect a little bit. Now, because Creutzfeldt-Jakob is a brain disorder, any abnormality in physical or emotional occurrences can happen. Symptoms are usually aphasia, pyrexia, ataxia, hemiparesis, myoclonic jerks, dysphagia. Again, because it occurs in the brain is kind of like the engine of the body. You know, once one thing goes bad, if it happens in one spot, you know, patients may get this symptom, and if it happens in another spot, person may get this symptom. So, depending on the type of mutation, because they have recognized that there are multiple mutations of the prion particle, is dependent on the symptoms that the patient encounters. Once the patient feels its first symptom, death usually occurs a couple months within a year. The death rate is at 100%, so it is a very fatal brain disease. There is no cure. There is no treatment. Most treatments tend to revolve around the alleviating of symptoms. So other than that, there is no vaccine. And a really interesting thing I had read was that there are a lot of family therapeutic ways to go about helping the patient feel comfortable. One of them is called reality therapy. And due to the loss of memory and the loss of surroundings that you can develop while being a CJD patient, it kind of helps family members and friends teach the patient how to recognize, what's real and what's not. So there are a lot of ways that we can help prevent the spread of disease. And again, you can go on CDC, which is the Center for Disease Control online site. Basic things such as if you're in the healthcare setting, wearing surgical gloves, masks, and gowns, making sure your instruments are properly sanitized, just small things like that, washing your hands, keeping everything clean, and this will definitely help with the spread of disease. So, again, my name is David Sable. That was my presentation on Creutzfeldt-Jakob disease, and enjoy.